The next thing that we would like to discuss is practice management software and cloud integration in digital dentistry. Again, like I did mention the last time that we had this conversation, in our dental practices today, there is a massive shift in the way that we manage our practice compared to how practices used to be managed in the past. Okay, can I ask those of you here, is there anyone that works in a clinic where the practice is still managed manually as it used to be many years ago? Where you still have patients file all in paper forms that you can go to your practice now, and there is one room that is condemned with so many piles of files and all of that. Is that a yes? Okay. Now, is your practice doing... Okay, so is your practice doing anything to incorporate the use of maybe computers, softwares, systems to minimize the filing? So the patient's record are now, they are using computers to do the patient record. Okay. 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 So what we are... Okay, that's good. So like what I told you previously, digital dentistry can be incorporated at different levels in your practice. So it's not something that you wake up one morning and your practice goes digital overnight. Okay, depending on the resources that is available to you, people in the Western world can, yeah, of course, get some loan, or maybe as an established practice, they can cough out a lot of money to invest and go full digital and incorporate digital technologies in most of the things that they do. However, for people in some struggling countries, or people who are practicing in areas where the economy is still struggling, then you can begin to incorporate digital dentistry at different levels of your practice. So it's not like you wake up one morning and go all digital. Now, coming back to practice management, there are softwares and cloud integrations that we use in practice management today that we didn't have many years ago. And again, some people still don't have it now. And we are hoping that with time, most people will begin to use these softwares to manage their practices. Now, digital dentistry extends beyond clinical tools like we have been looking at. We've looked at so many clinical tools that we use in digital dentistry, but now we can incorporate those digital tools into the administrative side of dentistry. Okay, so this there are a lot of systems now that you can use to do your scheduling. For instance, if you, I don't know, is there any person here that is involved in the administrative side of your practice? Is there any person here involved in the administrative side of your practice? Or is it completely left for admin people? How are you rotated? When you are doing your rota, who's going to work in this clinic? This person is assigned to this clinic. The other person is assigned to that clinic. About your meetings, when you book the appointments with the patients, what time you're supposed to see them, what time you're getting on break, and all of that. All of these things can be done using digital equipment. Okay, you can do your scheduling if you use Microsoft Teams. Microsoft Teams gives you an avenue to schedule your activities. You can book meetings with the patient, send an appointment, and the patient accepts the appointment, and it's recorded in your file that between this time and this time I'll be seeing this patient, and between this time and this time I'll be seeing that patient, and all of those things. So when we talk about incorporation of these practice management softwares and cloud integration, you can still do it with what you can afford. Okay, you can do. There are a lot of systems that you can do with what you can afford. It's not talking about when you will spend so much money to achieve that. So what are the advantages of practice management softwares and cloud integration? The benefits of these practice management softwares and cloud integration include that it improves workflow efficiently. Okay, there is improvement in workflow efficiency in the practice. It enhances patient management, so you can be able to track your patients without having to carry files and start looking for files. And when a patient comes in, you write their name in the record, and then you turn that one over, and you turn it over, and you turn it over. You can miss a patient on the in the queue as you are using that to pile things over. But there are systems that you can use that can even give you printed numbers for the patient, where the patient walks into the practice and the patient will just check in by themselves using that equipment that you put in your reception. So that when the patient checks in, they get a number. Okay, and then when the number is popped up on the screen, then they know that this is my number, it is my time. So it reduces the bureaucracy of having to rely on a receptionist to decide who goes in first and who goes in next. Okay, I don't know if you've had that experience where you go to somewhere and then the people that you have been there before they came are going in, and you're still waiting for someone to call you in, and then you're wondering what is going on. I came before this person and I came before that person. So simple tools like that can actually help you to order the patient flow for the day in your clinic. So it is better compliance with documentation standards. So you can use that not to increase your compliance with documentation standard. There are some examples of practice management softwares and iCloud integration that you might want to know about. Some of them include Dentistry, which is very popular. You have the EgoSoft, you have the Open Dental, you have the cloud-based systems such as the Tab 36, the Curve Dental. Again, outside of these fancy softwares and systems that are really, really developed specifically for dental practices, you can use Excel spreadsheet to help manage with your patients. Patient recording. You can use Microsoft Teams to actually organize your workflow in terms of patient management and practice management on the day-to-day activities. You can use that to manage your rota, assignment of clinicians to particular unit or particular stands where they will function, and all of that. So at any level where you can, it is expected that you should begin to incorporate digital dentistry and digital tools in your dental practice. Now, to conclude that aspect of core technologies in digital dentistry that we started from our last conversations, we have said that we have explored the evolution of digital dentistry. We've looked at how the concept of digital tools in dentistry started and where we are today, and we have also tried to imagine where we are going in the future. We've looked at the technologies, we've looked at the benefits, the challenges, and the future directions of digital dentistry. We have looked at the inception of digital dentistry, which can be traced to as far back as 1980. I don't know how many of us were born then, but as far back as 1980. So these ideas are old. This idea of digital dentistry is actually older than most people that are practicing dentistry now. So that was when the first dental computer-aided design and computer-aided manufacturing system was introduced by Dr. Francis Duret. Okay, so that he introduced that, and then this early attempt led to the foundation for integrating computer technologies into restorative dentistry. And then we've looked at advantages of software and hardware in early 20s. Digital dentistry became practical and commercially available and viable as early as far back as early 2000s. Okay, in the early 2000s, 2001, 2002, 2003, these things became commercially available and also viable options for dental practices to begin to incorporate them. And then we looked at the CBCTs, the iOS, the digital radiographies, and all of those things that we looked at. They started coming into play around the 2000, around early 2010, moving forward. And these tools significantly improved diagnostic precision, patient communications, setting the stage for the widespread adoption. So after the early 2010s, as we have looked at previously, we saw that this thing became really, really popular and people started widely accepting them. And now we are talking about digital dentistry and incorporation of digital dentistry into every dental practice. Okay, so that marks the end of that conversation around the origin of digital dentistry and the tools that are used in digital dentistry.